My name is Swati Kulkarni. I am a professor of surgery at Northwestern University Feinberg School of Medicine. I'm an attending breast surgeon at Northwestern Medicine and a member of Lurie Cancer Center. The PROMISE study was a multi-center phase 2 randomized placebo-controlled trial with the primary goal being to determine if an FDA-approved medication for menopausal symptoms could also potentially prevent breast cancer without impacting quality of life of postmenopausal women. So what we found from the trial, the main finding was that Ki-67, which is a marker of proliferation, was significantly decreased in the group that took the conjugated estrogens and bazedoxifene compared to placebo. And so why is this important? So this is important for really, I would say, two reasons. One, conjugated estrogens and bazedoxifene it contains estrogen. And for many years, women were told that estrogen was really bad for them. And so this is a trial that shows that an estrogen-containing compound actually reduces proliferation. I think the big takeaway for this study is if women who are concerned about their risk of developing breast cancer, this is a safe option for them, to treat their menopausal symptoms. The other, main takeaway I would say is that again more work needs to be done, but this particular medication, potentially could also prevent breast cancer. One of the things that we looked for is, would this medication actually improve quality of life, particularly hot flashes, in women who participated in the trial. And we didn't find a difference between the two groups, and there can be a couple of reasons for this. So number one, it wasn't an eligibility criteria for women to have hot flashes to enter the study. The second reason could be that potentially the time that the patients were on the study, 3 to 5 weeks, maybe that just wasn't long enough for us to really see that difference. And so one of the things that we're going to do is we're going to try to pick out those patients, because we do know who had hot flashes before they entered the study, because they had to fill out this question, this MenQual survey. The women who had hot flashes, and then we're going to compare the conjugated estrogen, bazedoxifene, and the placebo group to see if there was a difference between those two groups. This provides really strong evidence that there's a role for a longer-term study to see if this could truly prevent breast cancer.